So at the beginning of often the first consultation, not infrequently people ask whether us as mental health professionals, be it psychiatrist or therapist, psychologist, whether we actually have our own therapy. It always makes me smile because immediately, I suppose it's the nature of the job I'm doing. I'm curious about why people might ask. And it is also a nice moment to inject a bit of humor, which helps the initial engagement process and settling maybe people into the consultation. And so I often say something like, well, I wonder why you think I might need therapy. Or, of course, the cliche that perhaps psychiatrists are just a little mad themselves. So it's beyond that light-hearted approach, though, I think a very relevant question. And what might lie behind that, or perhaps implied in that question, is not just an understandable sense of curiosity, but it might actually also ask, do you know what my experience is like coming to see you? I think that's really important. And I learned this, and I share an anecdote with you about this later, but I learned this, and therefore I usually ask everyone coming for the first time how they feel about coming to see me as a mental health professional. Often people have that mixture of they really feel relieved to seek help. They're almost excited about that in that sense that help might be available, but also quite an understandable sense of apprehension and nervousness. That's fine. Or another answer might be, well, I just want to know what sort of training you have, what sort of qualification in a way you bring. And related to the question of one's own therapy is also the context that all professionals ideally are in supervision, which is related slightly different, either with a senior supervisor or in a peer group once you are more senior yourself. But the question of one's own therapy, for psychiatrists, it's not mandatory as part of their training. For the more traditional therapies, when one learns and studies them, it is often a mandatory part of training. For myself, being a cognitive behavior therapist, it was certainly, I was encouraged by my supervisor. It's optional, but I'm pleased that I did take up that option. I think it's a mixture of professional and personal development. I certainly benefited from it. I think it's important that one knows a little bit more about oneself because we also people we bring into the equation of a conversation. I think it's important to know what we might react stronger to than maybe other stories we hear. It's important also to become aware of one's blind spots, really to provide good care. And of course, it's personal development, so one can hide behind that a little bit too. And I do remember that. I was looking forward to it. I was really curious. I had a couple of things I was looking forward to explore and discuss. So I felt quite easy about it. And I remember the very first session, I came a long escalator up from one of the tube stations in London, and suddenly it hit me. I became really nervous. And I haven't forgotten, as you hear, that sort of experience. And I refer back to it in terms of acknowledging it's not an easy step to take. And you wonder what the person's like, what questions will be asked. Can you trust that person? What is the expectation? It's almost like, what performance will I give? So that's a valid question. It's very helpful. And the reasons are, ultimately, it's benefiting the person's and the patient's care, be it the supervision sessions we go to or maybe one's personal professional sort of therapy. It is all about that we become the best version of us as a professional. Supervision settings have the advantage that we get more than one opinion on a particular situation. I think it's professional to acknowledge I might not know all the answers. I just need to find out where to find the answers and not to hide or be particularly defensive about it. And that's all really served by these two settings. Then secondly, of course, it's our own personal and professional development. And thirdly, it is simply often a requirement from the professional bodies we are registered with. So, for example, the General Medical Council would expect us to be in peer group supervision. Some of the therapy professional bodies will expect that you are, again, in supervision. And for some, it's actually your own therapy experience to qualify in the first place. Your own therapy is usually in an individual setup. And it is, with a therapist pretty much the same as we later provide our patients with if we are trained in the various types of therapy. Supervision is slightly different. Supervision is a more professional setting. It also helps your personal professional development, but supervision is a structured setup, either individually or in a group, which is facilitated by a senior clinician, or later it is often a group of seniors coming together, which is called peer supervision. And this forum is predominantly used for that we have a chance to discuss our patients' presentations. It's very important to highlight that this is the same confidentiality as we treat everything else in our job. So stories are anonymized. We might refer to the person just by initials. But it gives us the chance to reflect on whether we have found the best way forward. It gives us a chance to check with others whether they would approach solutions to a presenting difficulty in a similar way. We collect other ideas. So it's very enriching, and it is really most of all for the benefit of the patient, because they get more than one opinion.